Welcome to Leaders and Legends, the podcast focused on leadership and clinical trial execution. I'm your host, Patty Leuchten, CEO of Diligent Pharma. In each episode, we'll get to know the individuals who are driving change and influencing the direction of our industry. Whether you're a seasoned executive yourself, an emerging leader, or simply passionate about clinical trials like I am, join us as we discuss our industry's most pressing challenges, the future of clinical trials, and hear insights and advice from the leaders who are moving our industry forward. So, Anita, welcome to Leaders and Legends. Thank you so much for being part of our podcast.
Yeah, thank you so much for having me here today, Patty.
So, I have so many questions for you, but I want to start with pure AI because it occurred to me that some of our listeners might not be familiar with your new or newish company. So could you talk a little bit about what Pure AI does?
Yeah, so as background, we started Pure AI about a year and a half ago, and we are applying generative AI to regulatory medical writing. So, obviously, the regulatory medical writing group is such a critical function when you think about the path to regulatory submission. But it is a group that historically has been very underserved when you look at kind of solutions that exist on the market, technology or service, and one that's been increasingly really overburdened when you think about, and I'm sure we'll talk about this, complexity of trials,
Yes.
huge volumes of data, always expectations around quick turnaround times for your regulatory documents. And it's a world that hasn't really changed much in the last few decades. So, kind of the thesis that we set out around and have really validated with our customers over the last year and a half is: can you take this entire new paradigm of technology and AI, which I'm sure we'll talk about more, and apply it to this problem space? And it's been really exciting to date. We're showing the value of helping timelines, helping in efficiency, helping in quality. And so we've been building out these technology solutions and working with medical writers at biotech companies, at pharma companies, at CROs, wherever this writing is happening, to kind of use this technology to support ultimately the regulatory submission process.
Very cool. And there's so many opportunities in these areas that haven't changed for decades and decades and decades, right?
Yes.
And I mean, we're in that space as well with
Right.
our qualification platform, and I definitely want to get into pure AI and just what you're seeing in terms of the innovations in technology. So we're going to come back to that.
Perfect.
But first, I'm just, can we talk a bit about how you got into clinical trials? You have such an interesting background. And, when we first met
Yeah.
through John Hubbard, I just knew you from working at Science 37, but in the meantime, I've learned a little bit more about your history. And I wonder if you could just share a little bit about just your early days and how you got into this space.
Yeah. How early should I go?
Well, I'm interested in the work you did in Jamaica and, with the Fulbright scholarship. So is that a good place
Yeah, that's
to
great.
to
I'll
start?
start by saying I'm sure, like many of the folks who are listening here, I was so sure that I was going to be a scientist, right? I loved science. I loved the puzzle of it. And I was actually part of this, computational quantitative biology program. It was about 20 students. 19 went on to get their PhD, and I was the sole one who didn't. And for me, it just ultimately wasn't a great fit when I thought about sort of lab work and that role. I just really liked um, being with people, figuring out some of these solutions, thinking about how do you actually apply some of this, incredible work that's happening in the lab. And so I took my own series of turns, spent some time in investment banking, and then on a whim, applied for a Fulbright grant to work in Kingston, Jamaica with the Ministry of Health. I had spent my time in college studying the HPV vaccine and the biology of it and the fascinating story around actual discovery of the vaccine. And the Fulbright was about bringing this into practice. So I actually spent half my time with officials at the ministry helping shape the nationwide HPV vaccine program. And my other half was really in the front lines. I was working with providers, doing the rounds in the hospital, understanding how they thought about entirely new interventions for their populations, and patients to say, how do they even think about preventative care? Like, how does this factor into their kind of broader, healthcare decisions? And it was such an interesting lens around, the economics, the social aspects, policy implications, thinking about this, HPV vaccination was going to happen in schools. What age do you do it? How do you talk about it? It was such a picture around kind of the reality that happens post lab of actually getting, these interventions to patients. And for me, it was such a turning point, right? I knew after that, like, this is where I wanted to be. I wanted to think about how do you accelerate these interventions, these really promising, either preventative or treatments getting into the hands of patients. And I think in my time there, obviously working in a developing country like Jamaica, but even seeing in the US, it just felt like there's so much opportunity, right? So much inefficiency, so many things that you would think could just be, easier. And that's where I just wanted to focus my career. And so I from there went on to have kind of series of roles working on the EHR side, working on, a couple genomics companies, and then like you mentioned, ended up at Science 37, which I think was such a formative experience for me. I mean, I was there for almost 7 years. Science 37, for those who may not know, pioneered kind of the concept of virtual or decentralized clinical trials, but the idea that you can participate in a clinical trial from the comfort of your home, which pre-COVID was, innovation, like a pipe dream. Like, can you imagine, having drugs shipped to your house, having a nurse come in, doing these visits through telemedicine? It was it, innovation was such a big vision, and I think I just saw, what that path looks like to make it a reality. I'm so proud when I think about the work that we did there. We recruited patients faster. We recruited these diverse populations, had really high engagement, and showed, you can bring innovation to life if you have that sort of vision. Um, and so in my role, and I think about how I just personally developed, I was there as the chief transformation officer, spent some time leading teams in product and strategy and quality and IT, and really shaping, the programs that we worked on with many of the big pharma, all the way from structuring the right sort of partnerships to thinking about change management when you're working in innovation, and building the appropriate technology as well. So such a crash course in turning innovation within clinical trials into reality, and what it takes. And for me, it was really the founding of some of the opportunity that eventually led me to starting Peer as well.
Yeah, that's great. And yeah, Science 37, as you said, really did pave the way. And it seems like it was sort of the perfect place for you to land, given your background and your interests and your passion at the time. And I'm sort of picturing you in Kingston, Jamaica, and light bulbs going off, and sort of this spark happening. And it seemed like you just knew that you were on sort of a different trajectory there. And I'm wondering if, what is it that sort of drew you to that in the first place? And is there a connecting of the dots to, maybe your upbringing? And, I know from our back and forth that you come from parents who were immigrants, which, you know, uh, a family going through that is a very specific, unique experience. And do you connect those dots between just this spark, this passion, and your childhood and your parents?
Yeah, it's such a good question. I mean, I really do. Yeah. So my parents immigrated here from India. I grew up in the Bay Area. And I feel like they brought so much of that immigrant mentality. Like, it was a hustle mentality. You work
Yeah.
hard, you do good work, you treat people with respect, and you take calculated risks. Like, it was such a risk for them to leave all they knew, all their family, all their friends, to come to the US for this opportunity they believed in. My dad was an entrepreneur, started his own company as well. So I feel like from a young age, it was just modeled for me this idea of, hey, if you're excited about things, like go for it, take that leap of faith, like be thoughtful and calculated about it, but
Mm-hmm.
to take risks. And they've been so supportive of around along the way about thinking about, your passion and what interests you. I think it's not easy when been in just thinking back to my undergrad, spending all this time, like, doing research and so sure about the science life and realizing
Yeah.
it's not just about interest, it's also about kind of your personality and the environments that you enjoy, um, and experimenting along with that and seeing what fits and where do you get that spark.
Yeah. Well, you sound like you have very supportive parents, and and that's, um sometimes not a given. I think, I
Yeah.
know plenty of friends and colleagues who, their parents really wanted them to just work hard and be in a very practical job, just make a living kind of
Yeah.
thing. And it sounds like you had a lot of support. So I had a similar experience of studying molecular biology and wanting to get out of the lab and into clinical trials. And I was thinking about the different points of connection that you and I have. In addition to molecular biology, you spent a lot of time in Princeton, being at Princeton
Mhm.
University,
Mhm.
right? And you started a business
Yeah.
with little kids, right? Like when you have,
Yeah.
if you don't mind talking about that, I started
Yeah.
my business when, as you know, when I had 3 kids under the age of 5. And I want to really get into Pure AI and what you do.
Yeah.
But
Yeah.
first, talk about starting a company when you are sort of, you know, you left Science 37, right? Very stable job at the time, and you probably had an idea of what the career path could look like there.
Yeah.
Why did you start your own business at the time? And
Yeah.
I know you described the industry dynamics, but what were the personal dynamics for you?
Yeah. And I remember, Patty, this was when we first met, when I was thinking about this decision of,
Yeah.
I want to start a company. I want to think about this, doing it as a mother. I have young kids as well. Um, I think there was a few things personally, right? I think when I think about just in general working with young kids, it's doing what my parents did for me, trying to think about being a model for them around taking risks around if you have this idea or the spark of something of excitement. Think about the practical nature too, but
Yeah.
go for it and take that leap. That's the only way you learn and you experiment and move forward in your career or in personal growth. So I've always thought about how can I model that for my kids as well. Um, I think for me, I'd always had this view of it that I recognize in retrospective, like trying to check all the boxes, like,
Hmm.
oh, I need experience in this, I need experience or that, or I need to like make sure I've done this before I can do something. And I had a friend say to me, you've checked every box. Like, you don't need any other qualifications. You just have to take the step. Like, you are naturally just ready. And anybody is. And sometimes
Hmm.
you worry if what you might need to do something, but you will never know unless you actually do it. And I think that's where I was. I felt like I'd seen so much of the industry now, Science 37 and other roles. I had friends and models for me, including my parents, who had taken that step as an entrepreneur. I was really excited about this entire new paradigm of technology, of AI. It was just so exciting that it felt like this was a great time, right? I had this whole list of ideas of places where I thought there was opportunity. It felt like just a good time to do that and test it out because everything is changing. I really do believe that in a clinical trials world. So, jumping into just be a part of that.
Yeah. Well, and again, it's another sort of milestone that when I think back on what you described as your story, it actually does make sense in terms
Yeah.
of your education, your background, your upbringing, all the experience that you had with Science 37, and then bringing that all together to launch a business. And so a year and a half in, are there things that sort of, were surprising to you as a business owner that you didn't anticipate? Um, what has been sort of either the biggest surprise or the biggest challenge with getting Peer AI off the ground?
Yeah. I think I remember someone saying this to me, but it's so easy to forget sometimes that you can have all these ideas, you can know what sort of technology to build, but the most critical piece is going to be the culture you build. Like the how do you actually create an environment where smart driven people can thrive? And I think, at Peer, I feel like our magic is that we have this cross disciplinary team, like very much what we had at Science 37 too. We have teams of regulatory writers, people who grew up in the ranks of, biotech and pharma, decades and doing things in very specific ways. And other half of our company is all AI engineers. That is a culture within itself around experimentation and trying things, iterating so quickly and not being, confined.
Yes.
Putting those two together, on paper, it's magic, right? If you can figure out how to harness the power and the beauty of AI with like really understanding this problem space, which is what, I feel like we're really doing, that's magical. Figuring out how to bring that together in practice is actually really hard. And it forced me, I think, to start with defining our values, defining our working style, and thinking about the constructs that actually enable that in practice. So all our values are really around things like working as a team and winning as a team, being and empowering expertise. So actually recognizing that each other is experts, and there's this aspect of empathy that has to be there for you to actually figure out how to solve this problem together. And then thinking about the constructs of how that happened. I mean, we've implemented something we called watch parties, which is where these groups literally watch each other work and do these things in practice. And you sometimes need that to understand how engineering happens, how medical writing happens. Like I joke that I think our engineers could be junior medical writers, and I think our medical writers could be junior engineers.
Oh,
But I think that's what has to
interesting.
happen. So I think it's not that it's been surprising because I think, at companies innovating in the space, that's sort of part of the requirement. I think I've learned how hard it is and how intentional you have to be to facilitate that type of collaboration.
Yeah, what an interesting and fun challenge, though. It's almost like you have, in some ways, these two kind of parallel universes of
Ew.
individuals with their, their own ways of thinking and doing things, and then to bridge the gaps and to bring them together. That, you know,
Yeah.
it magic is a good word for it. And we talked about you. Your solution is addressing, some kind of entrenched issues, problems,
Mhm.
challenges in the clinical trial execution process. And I know one of the things that we found at Diligent is that even if you have a solution that makes sense, it is sometimes difficult
Mhm.
for companies to adopt a new way of working,
Yeah.
even when they acknowledge that they need a new way of working.
Yes.
And as you know, as a you know, as a leader, you go into launching a business with so much enthusiasm, optimism, passion, excitement. You're wanting to make a difference, and you have something that could be transformational. What do you do when you bump up against that either resistance or just sluggishness, or just the typical long sales cycle that exists in the clinical trial world? Or is it not that way for you guys? Because I know that's what we're experiencing. I'm hearing from other um, business owners of tech companies in the clinical trial
Mhm.
space that it's pretty universal, but I'd love to hear that it's not, if that's the case with pure AI.
No. Yeah, I mean, I think that that's part of working in this space. I think of it in a couple dimensions and really leaning on, again, what I learned from Science 37, which I would say was so far ahead in pitching, what innovation means. Um, we think of it as a couple lenses. Maybe I'll just say, yeah, I agree with you in the sense of our biggest competition is the status quo.
Yes.
There's recognition, but this question of why should I change things if I know it works? So I'll say there's a couple of things that I think have worked really well for us. The first is objective data that shows the
Mm.
value. I think uh, in all of our conversations, it often starts with AI task force or the AI strategic leader. And I'm always asking, I want to talk to your regulatory writers. I want to talk to the people who are experiencing these pain points because what we want to present is the value that we're bringing to those departments and those teams, and bringing it in the most quantitative way we can. So we focused this last year and a half in building as many case studies as we can, like objective quantitative metrics as we can, um, showing how we think about measuring quality, which is, I'll say, I think it's a gap in our industry. There's no framework for it. So we've defined our own and sort of shared it as a way to look at quality of output as well. But bringing this way of saying, how do you actually assess the value beyond just this dream or using buzzwords like AI, but how do you actually
Mhm.
think about the value for medical writing? AI is just the means. How do you think about the value of the solution? So I think that framing has been helpful. I also think we have led with transparency and really this authenticity. Like, again, thinking about our value around be the expert, saying we are all on this frontier of AI. Let us show you what that means and what that looks like. That means telling our customers where things fall short. Like being clear. AI is not this magic solution. There are things that are
Right.
not good, and we want to tell you. There are things that work really well, and we want to show you that. So being very transparent, we take every customer under the hood, show them how we think about things, show them code, show them output, because our view is everyone is learning and we should learn from each other. And leading in that way, I think, is the right way to sort of help biopharma sort of crawl, walk, run into adoption in this space as well.
Yeah.
Um, and then I'd say last thing is like it's been helpful to always find our champion.
Mhm.
In worlds of innovation, that's kind of what you need, someone who believes in this and will help drive the action, whether it's starting with a pilot or shaping the right partnership, whatever that first starting point is, finding your champion who's going to help you keep driving that forward.
Yeah. Um, it sounds like you're really helping to demystify AI by the transparency, right?
Yeah.
And are you finding with your client conversations that there is, with some individuals, maybe a fear that either your business or AI itself is just going to take over their job, and that there's, some self-preservation maybe kicks in
Yeah.
terms of not wanting to adopt new ways of working?
I do think, yeah, I mean, I kind of view it as this theme of there's a learning curve around AI. You have one bucket of people who expect magic. They just said the
Yeah.
machine can do this. It's like, well,
Right.
hold on, that's not how things work. And then you're right, there's one bucket who does feel like there's this fear around job security, whether it's explicit or sort of, subconscious. And I think what our approach to that has been recognition of it,
Mhm.
and really trying to, again, bring to the surface why we don't think that's true. I mean, we named the company Peer because that is my true belief. Like, we want to be a peer to regulatory writers, additional sort of functional experts as we continue to grow. And there is a level of expertise that I don't think AI will ever replace. And so explaining why behind that, and then leaning on, we employ medical writers for this reason, to be able to have this conversation from a peer perspective, on what they've learned, what they see the opportunity to be, and um, what I think the future of medical writing really looks like.
Mhm.
But I think it's an ongoing conversation, and our approach has been tackle it really head on to understand, the kind of underlying concerns.
Yeah. Well, you mentioned you used the word empathy when you talked
Mhm.
about your own internal culture and having you know, great working relationships
Mhm.
internally and how that's important. And it sounds like you're applying that with your clients as well, sort of getting into their world, their shoes, and, you know, leading with communication, transparency.
Yeah.
I think that's great. It's different than in, I think, the early days of tech innovation, where there was sort of this idea that there's margin in mystery.
Mm.
That if smoke and mirrors, but it sounds like this is the total opposite of that, and it's admirable.
Yeah, I think maybe because I've spent so much of my career in product, I don't think you can build a good solution without truly understanding, the party that's gonna benefit in the end, all the
Totally
way from
agree.
how do they do this work to how will they adopt new solutions, what is the mental model? Like, I think that's just so critical to build the right solution and then drive ultimately adoption, which is, our goal.
Yeah. Well, let's talk just a little bit more about um, evolving technology, because you know, before I had Diligent, it was almost like I would try to keep up with technology and what was happening in the whole world of AI, but almost admiring it from afar, right? But
Mhm.
now having a platform and having a tech team, and we have our own sort of innovation lab ourselves, we get to prototype things.
Yeah.
But what I'm finding is it is evolving so quickly, and the technology is advancing in ways that you really have to keep up in terms of being very savvy about the right use cases and
Mhm.
how to apply technology in the right way, both for internal operations and efficiency, as well as for your clients to add value. And I wonder if you could talk about that from your perspective, just how pure AI is sort of um, you know keeping up in a very first dynamic industry, but also with technology that is constantly changing.
Yeah. It is a challenge, we have a whole, channel in Slack around new technology. I feel like every other day it's sort of like, "Oh, this model just dropped and that model just dropped," and I think this is where I feel really grateful to have this, amazing tech team, all the way from our technology lead comes over from Google to our advisors who are at many of these, larger AI companies as well, to kind of parse through a lot of noise to say, which was, where do we actually focus, where do we not, and sort of this culture around let's keep iterating. So we have a compound AI system where we're using different models and different ways of using AI at different steps. And a lot of that just comes down to kind of experimenting as new sort of technology comes out and trying to stay abreast of what's actually happening in other industries too, in terms of vertical AI applications. And can we learn from those best practices as well? So I feel like it's more of an art than a science of trying
Yes.
to, 80/20s, keep track of what's out there. Um,
Hmm.
but for us, it just comes down to, hey, do we have enough the right teams, advisors, investors who can help us, make sure we're hitting the really big important things too.
Yeah, and I know it's hard to sort of predict the future
Mm.
and where things are going, but in your space, sort of in the regulatory space, do you have thoughts about that? I mean, it feels to me that the industry is just becoming, more and more complex, new players coming
Mhm.
into the market. Just protocols are becoming much more complex. And what occurred to me the other day is that the technology is addressing some of the complexity, like with now having large language models and being able to, sift through and analyze data so quickly. But in some ways, it actually could be a catalyst for even more complexity then. So
Um,
it has the potential for a snowball
yeah.
effect. Um, and, I know we sit around, our leadership team thinks about sort of the future of our sort of niche and world of qualification and audits. And how do you think about your niche and your world and how it's going to evolve in the
Yeah.
next, say, 5 to 10 years?
Yeah, I mean, it's we sit in such an interesting space because you're thinking about the trial execution. You're sitting, with kind of how there's a whole aspect of how will regulatory bodies themselves change in how they're, thinking about some of these decisions and evaluation of data and whatnot too. And I think the FDA has been really vocal about like their perspective around innovation, which is so exciting and so promising too. I think the things that I get excited about is as I have learned, how working with some of these larger pharma companies, kind of the layers and layers of work that has just been added to try and fix things over time, you've ended up in some places with spaghetti. And so I think in a
Yes.
way, there are just huge steps that we're going to take out of the process. We're going to jump from point A to point, M faster and skip all these other things. And so I almost think of innovation as going to be so much process innovation where there's just steps we're going to start to cut out. Um, and I think that's what's exciting, and we'll just reframe it. I see this even on the drug discovery side on how so much of that is changing when you look at more, synthetic trials and whatnot too. So I feel like the whole model has this opportunity to just be turned on its head. We get excited about even just the where UI is going today. We have been prototyping with adding,
Hmm.
peer to a meeting and collecting all of the meeting conversation and actually putting that into documents, right? There's so much.
Yeah.
You don't have to write this down. You don't have to put in a questionnaire. You can actually just gather it from conversation and start to start to document this work. And so I just see, these ways we collaborate facilitating kind of the end deliverables just so much faster and so differently than we've done, before in the past.
Yeah. We had our leadership team meeting this week, offsite 2-day meeting, and as we were talking about the potential of leveraging generative AI within the company, I actually felt like in my body, I started feeling like nervous, like, are we doing enough? Should we be doing more? Because there's so many ways that you can, um, not replace, but support
Of
your
course.
workforce in terms of just making their lives easier, their jobs easier,
Yes.
shortening timelines, driving efficiency, which, as a business owner is super important. It touches
Yeah.
on culture. It touches on ensuring that you have, this that you're profitable. So there's
Yeah.
there's there's so much. And, we sort of recognize that we're also, um, most of the time working in the business. I think
Mhm.
our CTO said it. He said, you know, we do have to sort of take a step out, work on the business,
Yeah.
sort of slow down in order to hurry up and
Mhm.
figure out the best uses of technology. And so I think everybody is likely in this same boat.
Absolutely. Yeah, absolutely. And this is where I go back to, do you have a culture that invites that and enables that?
Yeah.
Because we see it ourselves. Every function at our company is using AI for their own daily work, and it's
Mhm.
amazing. We have time carved out to actually just share best practices and things that worked really well, and continue to drive that for our own efficiency. And it's not. I agree with you. It's not replacing. It's actually taking out things that I don't enjoy doing,
Right.
or it feels like such a
Yes.
distraction from the
Right.
core strategic things I wanna think about. So
Right.
it's made me more of a 10x, employee, and that's how my team thinks about it. I think we take that into what we're building too.
Yeah. Yeah. And we've talked about how the subject matter expertise will always be,
Yes.
front and center in the way we're working with clients. And I think that's one of the fallacies as well, that you're
Yes.
going to lose that expertise, but it's actually a force multiplier when you combine
I agree.
the tech with the subject matter expertise.
Yeah, I agree.
And I think companies like Peer AI really do have an opportunity to serve as a catalyst for change, because large companies, they do have a difficulty in even knowing what is available to their workforce.
Right.
Things are moving so quickly, and there's so many competing priorities that
Mhm.
it's very inspiring to me to think of a small company being able to drive huge change
Yeah.
within a very complex industry. And I know it's what was a spark when I started my company all those years ago. It's a spark now with the work we do with Diligent, and I would imagine that it's part of the culture of your company as well, from what you described.
Yeah. Yeah, I think so much of it comes down to often painting the big vision, right? Like this is what I feel like I really learned in my time in Science 37 from the leadership there. Like you need you there's so much value in painting the future and showing the art of the possible. And I think that's really helped us to show like where is this going? What can you do as an organization? Backing it with all the numbers we have around speed and efficiency and quality. But I think that's what excites people. That's what, really pushes people to take that next step when they get excited about the change in their role or their organizations, how they function. So I think that's for me as a leader, what I've tried to really continue to push on is how do I paint that vision in a way that resonates and excites not just our team, but our customers as well.
Absolutely. I could talk forever with you, Anita. This has been so much fun. I do have one last question for you about leadership, and um, it's really around what you're working on personally as a leader. Because you seem to me to be sort of a person that's always wanting to grow and evolve, and you're in a very dynamic role right now. But what are what do you feel like you sort of need to sort of dive into a little bit more, or work on yourself as a leader?
Yeah. I'll say the one thing that's been, continues to be hard is you see so much opportunity, right? Like for us in regulatory writing, we're starting to get inquiries in medical affairs and commercial. And I almost have to stay excited about that, but keep my team really focused, right? We have to
Yeah.
focus and execute well. And keeping that balance sometimes is so hard. When you have a customer that says, "We love this and we want to do this," you want to
Oh
say
my
yes,
gosh.
because you see
Yeah.
the potential and you see the opportunity. But I think my job has been really set a finite of things for the team to prioritize and work on and do that work well. So, like, really focus on what are we going to do this month? What are we going to do this quarter? And not get distracted, especially when there's so much news that comes out or things you can do or no technology. It's really easy to lose focus. Um, which is it's exciting. It's exciting to be in that position, but
Yes.
a discipline I think we've had to have and, starting with me really, keeping day to day.
Yeah, I could see where somebody who is a visionary has a lot of ideas, that you do have to be intentional about that. And we've talked about how strategy is also saying no. Good strategy
100%.
is saying no to things as well, and being very discerning. And so I'm with you there. Well, Anita, thank you so much. You are so impressive, and it's been so much fun to talk with you.
Thank you, Patty. This was so fun. I appreciate you inviting me.